Antibiotics resistance is a growing public health concern worldwide. When a person is infected with an antibiotic-resistant bacterium, not only is treatment of that patient more difficult, but the antibiotic-resistant bacterium may spread to other people. This week commemorates World Antibiotic Resistance Week. As News Central's Bettina Nwelih files in this report.
When antibiotics don't work, the result can be longer illnesses, more complicated illnesses, more doctor visits, the use of stronger and more expensive drugs, or more deaths caused by bacterial infections. Over the years, different types of bacteria have become resistant to antibiotics. Skin infections, urinary tract infections, meningitis, sexually transmitted diseases, and respiratory tract infections such as pneumonia.
Actually, I use antibiotic when I'm sick, when I go to the hospital, and maybe they find out maybe I have some bacteria or some infection. They prescribe antibiotic for me to take.
Antibiotic, sometimes it is used for maybe when you are having headache or body pain. At times, you can get it. It's used to relieve some pains we had sometimes.
No, I don't just buy antibiotics. So no, I like doing checkup. I do checkup first. Even for my children too, I do checkup. And even me, I know some antibiotics already, but I won't buy it. I will confirm first if it is the right one to use, and I don't just buy drugs anyhow again. No.
Primarily to aid treatments. Probably after I've treated malaria or typhoid, sometimes I just take antibiotics so as to aid the treatment and to fight any bacteria in the body. So that is what I use antibiotics for.
Antibiotics are meant to be used against bacterial infections. Although antibiotics kill bacteria, they are not effective against viruses and will not be effective against viral infections such as colds, most coughs, many types of sore throat, and flu. Using antibiotics against viral infections will not cure the infection, nor will it keep other individuals from catching the virus. It will not help a person feel better and may cause unnecessary harmful side effects, which may contribute to the development of antibiotic-resistant bacteria.
Sale of antibiotics without prescription or other professional supervision remains widespread. This means that there is a risk that antibiotics are still being used too frequently and too often when they may not be needed.
Patients and healthcare professionals alike play an important role in combating antibiotic resistance. Patients should not demand antibiotics when a healthcare professional says the drugs are not needed. Healthcare professionals should prescribe antibiotic only for infections they believe to be caused by bacteria.
Some people have little headache and then they go and get antibiotics. There are still some people that after sex, they go and get antibiotics. They get ampiclos like cut 2, cut 3 for me. I want to do washing and setting, that the antibiotics will wash and set their system. Some even take it as contraceptive. That's like some even take it as should I say, an abortive pill, so an abortion pill that it will help remove the baby. So this is ignorance. So one of the ways to curb this thing is to curb ignorance.
Taking the wrong medicine can delay getting the appropriate treatment and may allow your condition to worsen. Bettina Nwelih, reporting for News Central.